Erie News Now continues to bring you mental health coverage all week long, and this morning we are taking a look at the difficult conversation that parents have when it comes to explaining loss, grief, death to their kids.
And we thank you. We have Brittany Hayden, Vice President of Clinical Services for us at Sarah Reed Children's Center, joining us this morning to talk about this very difficult subject.
I'm very grateful to be here. Thank you.
And as we continue to mourn the loss of our Emily Matson, moms like Tracy are having to have those difficult conversations with their kids about loss, about death. How do you even start that conversation, Dr. Hayden?
Well, I think it's challenging because even as grown-ups, we don't like to talk about death. And so I think it's normal to want to protect our children from the pain of loss. And unfortunately, by protecting them and covering up what death really means and the finality of death, it actually kind of stunts the grieving process. So it's really important to be direct and concrete and clear. It's okay to say the words dead, has died. I think sometimes we want to soften the finality of death by using euphemisms, such as passed away, went to sleep.
Sure.
And that doesn't make it clear, and it can lead to confusion, but maybe the loved one will come back, especially for particularly young children.
Sure. Now, how does age factor into how you have these conversations?
Yeah, great question. I think the way that grief is received and the way that it kind of plays out varies largely based on age, developmental level, temperament, but also how the loved ones in their lives, in a child's life, is also grieving. So for those littles, even toddlers and pre-verbal children can pick up that something's not quite right.
Sure.
Preschool children have a really hard time understanding the finality of death. So that's why using those euphemisms and trying to be direct and clear, as much as they can developmentally tolerate, is important.
When the death is a suicide, does that change how you handle that conversation with the kids?
It changes it a little bit. You still want to make clear that the loved one is not coming back. And it's important to explain what death means based on your own family's values and background.
Sure.
So I think that you have to learn a little bit about what your child can tolerate, how much information they can tolerate. So I think it's important to start with that finality piece of death, and then trying to gauge how much they can tolerate from it.
And answer those questions the best
Answer
you're
all
able.
the questions, normalize feelings, show your own grieving. If you're hiding your own emotions, the child's going to feel like they can't express how they're feeling. And you might have to answer the same questions over and over again. Be patient and support them through that process.
Thank you.
Dr. Brittany Hayden from the Sarah Reed Children's Center offering up us some advice on how to have that difficult conversation about loss with your kids. And there are a lot of great resources at Sarah Reed's Children's Center, and you can get a look at all of the resources that we have available here at home all across the region by heading to erienewsnow.com. We've got a great resource page set up right there, a QR code that you can use to scan and get right to it. So again, as we continue our coverage of mental health awareness all week long here at Erie News Now, once again, say thanks to Dr. Brittany Hayden from the Sarah Reed Children's Center.
Turning now